Well, you ever wake up feeling stuffed up?
Today?
Yeah,
And
yeah.
a lot of days lately?
Absolutely. I think many people can agree, and it's definitely not fun.
No. Now in the Brazos Valley, though, there's an easier way to treat those chronic symptoms without going under the knife. One local ear, nose, and throat specialist is using a technology called the sinus balloon. KAG's HD News reporter Chris Costa shows us why this technology is saving people time and money.
Sinus pressure has a familiar face. When it gets worse, it can turn into sinusitis, a sinus infection. There are multiple triggers for sinusitis, some even as simple as a common cold or allergies.
How are things going with you? Are you good?
Good.
Dr. Ron Coopersmith is an otolaryngologist, a doctor who treats ear, nose, and throat conditions at Texas ENT in College Station. He's one of the first doctors in the Brazos Valley to treat patients with the sinus balloon.
Since the technology has become more streamlined and easier to use, it's now in not all patients, but in a lot of patients, it can be done in the office setting, which I think patients tend to prefer.
Here's how it works. The doctor inserts this small balloon into the 4 different pairs of sinus pathways. Why is it called a balloon? Because it literally gets inflated, causing a series of tiny microfractures around the pathways in order to reshape and expand them. After 5 seconds, the balloon is deflated and removed, and the sinus pathways stay expanded. But the sinus balloon is meant for recurring symptoms, lasting anywhere from 4 to 12 weeks or more. Margie Debney woke up every morning feeling stuffed up.
Very frustrating, just because you didn't feel really well and you want to be on the top of your game. So it was frustrating that I couldn't breathe, and it just made life difficult.
Studies show that when used on the properly selected patients, the sinus balloon was 90% effective, something that patients say they noticed in a matter of weeks.
I think it's an easy procedure to get over, and I think that is just so important because, like I said, I had lots to do and I didn't have time to sit around and recuperate.
A typical procedure lasts about 90 minutes, and since doctors use local anesthesia, they can see patients right in their office. Patients report being back to normal activity within about 2 days.
It fills a really nice gap, where we have patients that were suffering from chronic problems that didn't want to go to the operating room, or the problems didn't seem quite bad enough to go to the operating room, and this gives those patients an option and gives them relief.
Saving time and money with a clearer head. In College Station, Chris Costa, KAG's HD News.
Dr. Coopersmith says there are a number of factors to determine whether or not this procedure is right for you, and that the first step is to make an appointment with an ear, nose, and throat specialist.